the staff they are not expecting emergencies. We have adopted a strategy where we train our staff to go to the basics of monitoring, where just maybe, for example, the pulse or just by observing. Most of the times, these skills they have, but they don't use them to identify these cases. Communication becomes key, especially to communicate to the expertise you need. They may not be available, but a platform for easy communication becomes key. That is why I thought initially of a WhatsApp group. We brief the staff on how to identify these emergencies and communicate. At times, when this early identification by the carers is not made, it's difficult for us to respond timely.
Welcome back to our discussion, Clinton. What is your experience with managing patients, critically ill patients in the world?
Managing patients in the world for us, the challenges we face as medical doctors is that the world seems not to be a setting for emergencies where we have the ICU, we have the casualty, we know that the staff there, they are always expecting emergencies. But in the wards, usually, the staff, they are not expecting emergencies. So when of course, arise, they not notice. Even if they notice, they have difficulties in relaying. And even when they relay, when we come and the response usually is very slow. So we always have that challenge in the world.
How in the world with less resources, less material, how do you identify or diagnose patients with critically ill conditions?
It's really challenging for us working in this low resource settings because the limited resources that are there are usually confined in places where we expect those emergencies, like for example the monitors and everything. So we have adopted a strategy where we train our staff to go to the basics of monitoring, where just maybe, for example, the pulse or just by observing, you could identify patients in emergencies.
Your team in the hospitals, what do you think is needed to capacitate the teams to be able to attend to these patients in need?
Our setting is just a constant reminder because most of the times these skills they have, but they don't use them to identify these cases. So it's a constant reminder. Then we give them a checklist for patients that may be in danger in the wards. While they do their routine checks, and the checklist will guide them to identify those cases and to relay and to improve on the relay. We could maybe reduce the communication, maybe create a group or maybe a WhatsApp group where for immediate communication, and we could also place a hotline where if you're calling any person in need, yes, when the person sees that it's an emergency number calling, they will respond faster.
With the human resources that we have, do you think the advent of technology can help us? And if so, have you had maybe an innovative solution in your practice to help in identifying and promptly managing patients who are critical?
In the movies, we see how some certain emergencies usually trigger the activation of certain teams, and when they come, they are very specialized in the response, the appropriate response. But since we are limited in that, communication becomes key, especially to communicate to the expertise you need. They may not be available, but a platform for easy communication becomes key. That is why I thought initially of a WhatsApp group where you could express your worries. And if the WhatsApp group maybe is termed an emergency WhatsApp group, I think if a message comes in and any person is beside the phone and sees that it's coming from the emergency, they may want to respond and give their contributions, or you use the hotline to communicate, because it's very difficult to say that we have an expert team always available in our setting. So to create an easy communication to the experts, even though they may not be there, could help sometimes.
Okay, maybe you've pointed to the creation of the WhatsApp group. Can you share with us, maybe you have done that in your own setting, and how is it effective in promptly intervening to critically ill ward-based patients?
I personally recommend this because we've had the experience firsthand
Okay.
where we had a lot of inwards emergencies that were responded late and the outcomes were not good.
Okay.
But when we created the WhatsApp group and we briefed the staff on how to identify these emergencies and communicate, because I realized that sometimes these people they identify the emergencies, but they don't even know who to communicate to, and they don't know if the communication would trigger the appropriate response. So at times it discourages even reporting. In the emergency group now, when a case comes, we have many heads that go through it, recommendations, and then there's a focal person who is in charge of implementing these actions or confirming these the cases that come in, give a feedback, we discuss on it, then we see what we can do and we evaluate the progress. So it has helped a lot in our facility where I think the cases of mortality in the wards have reduced drastically. Our unit heads, our ward charges, they have the responsibility to routinely talk with the staff in the wards to identify these cases, communicate to the group, and all of us, we contribute to it. Then the focal person goes down to the field to see how we could implement these discussions and everything.
What are some of the recommendations you want to make? Do you think we carers need to come into play? Maybe we need a concept where carers can identify that my patient is becoming serious and maybe tell the nurses in the ward who now, because we've also had situations where nurses have gone to the ward and just confirmed that the patient is dead, meanwhile the carers were sitting there.
In our setting, because of limited personnel, we know our nurses are usually not stationed in the wards, but in their station. So some of these emergencies, we rely greatly on carers to communicate, to trigger. Then the nurses monitor and assess the severity and communicate forward so that the appropriate response will be made. But at times when this early identification by the carers is not made, it's difficult for us to respond timely. Yes, so I think that it's important because what we do is, especially when we have incorporated in our facility, is that when we diagnose or when we identify a patient with a higher needs, yes, when it comes to medical care, we behind the record we outline a plan even that incorporates the carers. If, for example, a patient is monitored on oxygen, if you put just a monitoring machine, you could inform the carer that when these values are like this, or when this machine sounds like this, you let us know. Yes, it's very important in our setting because we are limited. Yes, if we don't, or maybe a patient maybe drowning in aspirations, we must educate the carers, the care identification of danger signs into our care. Thank you once more for that discussion, and it's the second round of our discussion on critically ill ward-based patients. Is very important. We know it's sad when we have patients we think could revive them, give them back to their loved ones, and we find out that these patients are dying. And when they die, and when deaths are preventable, sometimes we are also emotionally drained. We go into emotional distress because we know we could do better. We could do better. So I think we will continue to advocate for something better. We will continue to work as teams to make sure that
we train our colleagues, we work with everybody, the carers, the patients, to make sure that we are able to curb the number of deaths that occur from critical illnesses in our world. So once more, thank you for coming.